If you've been told you're insulin resistant or have blood sugar regulation issues, you've probably been told one of these three simple explanations. Eat less sugar, move more, try harder. But here's a pattern that I notice regularly in clinical practice. Two people can be following similar or the exact same advice and get completely different results. One of them improves while one feels stuck, frustrated, and confused as to why nothing's working. I'm Dr. Kenny, and as an IFM certified functional medicine practitioner, this is one of the most common themes that comes up when we look under the surface of what's going on with blood sugar balance and metabolism concerns. In this video, we're going to explore and clarify exactly what drives insulin resistance, and then walk through 4 practical tactics to help flatten the blood sugar roller coaster out. And if you appreciate this kind of root cause nuance and discussion, go ahead and tap the like button to help this message reach other people who might be searching for it. Insulin resistance has quickly become the defining metabolic pattern of modern life. The problem is that it's sneaky. It shows up very slowly, oftentimes imperceptible for years or even decades before it becomes a problem. Then your fasting glucose trends upwards, your HbA1c may be climbing, and symptoms-wise, your energy becomes less stable, your focus becomes disrupted, or weight becomes very difficult to maintain. What often makes it confusing is that people are trying to do all the right things, moving more, eating less sugar, paying attention to carbs, and yet their numbers don't seem to improve. And to me, that's usually a signal that we're focusing more on an external expression rather than getting to below the surface. Before we talk about the tactics to handle insulin resistance, let's dive into understanding exactly what it is. For starters, insulin resistance is not the same thing as high blood sugar. And it's not simply eating too many carbs. There's many other processes, including stress chemistry, that adds to the picture of insulin resistance. At its core, insulin resistance means that your cells are not responding appropriately or efficiently to the presence of insulin. Insulin's primary job is to move glucose from the bloodstream into the tissues, where it can either be used for energy or stored for future fuel. In our ancestors, being able to store sugar in this way was actually a survival mechanism. Now, in our modern culture, and considering the context of food industry and empty calories, that same survival mechanism has become the driving force for many chronic conditions ranging from heart disease to Alzheimer's and, of course, to type 2 diabetes. When your tissues and cells stop responding to insulin as efficiently, the pancreas compensates by producing more insulin to try and get the same job done. Over time, that compensatory reaction becomes the quote-unquote new normal. So there's higher insulin levels, there's more strain on your metabolic efficiency, and eventually your glucose numbers rise after sometimes years or decades of insulin itself being high. So the real question becomes this: why are the cells resisting the signal in the first place? And that's where we shift from the surface explanation to more of the root cause understanding. Plain and simple, the central driver of insulin resistance is energy overload. In other words, it's a situation where the body is consistently taking in more forms of energy than it has the ability to process and use. When you strip away the labels and look at the function or the physiology itself, insulin resistance almost always follows a pattern that reflects a mismatch between fuel coming in and fuel being burned or stored appropriately. And this isn't about a single meal or a single dessert in any way. It's about a sustained mismatch between your metabolic capacity and the incoming energy sources. When that imbalance persists over time, the tissues and the cells begin to protect themselves from further influx, because having too many calories in the forms of sugar in the cell are actually toxic to the cells. And this is where a lot of conversations tend to oversimplify things, from the calories in, calories out camp to the ketogenic or the intermittent fasting camps as well. In reality, insulin signaling, blood sugar balance, metabolism, they are far more complex than a single bad guy. But the broader issue is the cumulative energy burden on the system, whether we're talking about the food burden over time, the hormonal compensation and adjustments, or in reality, a combination of the two. So if that's the driver, the next step is understanding how that overload turns into resistance at the tissue level. When tissues are repeatedly exposed to more energy than they can process, they adapt. The most noteworthy are the muscle and the liver cells, which accept glucose when insulin tells them to. But if those cells are already full of energy, that signal becomes less effective. The insulin doesn't disappear right away, but rather the receiving tissues, like the liver and muscle cells, gradually become less responsive. And we see this in cellular changes to the composition of the cell membrane structures. At first, the body compensates in response to this. The pancreas produces a lot more insulin to again shove the glucose into the cells. And for a while, this works, and your normal blood work won't pick up on these signatures that are happening underneath. But underneath that facade of stability, insulin levels are climbing for years or even decades before it shows up in your glucose levels. But all in all, the system is working harder to achieve the same effect because the body must maintain a very narrow window of glucose in the bloodstream at any given time. Any more than that, and you get situations of hypo or hyperglycemia. And human research shows that insulin levels do rise before glucose numbers change, which fits this compensatory pattern. So if overload is the driver, one of the first areas we can turn our attention to is intake, particularly with carbohydrates. So let's start there. Carbohydrates are the most direct source of glucose that our bodies intake. When your carb intake is high and frequent, so is your glucose intake. But controlling carbohydrate intake may not be about removing carbs entirely, as many extreme dietary protocols do call for. It's about reducing the overall glucose burden so that the system underneath can switch between burning both carbs and fats for fuel. This is a concept known as metabolic switching. Now, there is a solid body of human research that shows that limiting carbs can improve markers associated with insulin resistance in many individuals. And by the way, if you're one who likes to see the research for yourself, I've included a free research summary below with some of the articles I used for this exact video. It's in the pinned comment in the description below if you would like to review them directly. Once we turn focus to carbohydrate intake, the next piece is making sure that the body has the right structural and healing support. And this is where protein comes in. Protein serves a very different metabolic role than both carbohydrates and fats. It supports the structure, the repair, and perhaps most importantly with glucose and insulin resistance, muscle tissue. In the context of insulin resistance, protein intake helps to stabilize. One of its main functions is to support satiety in a big way. So we focus on carbs to decrease the incoming glucose load, while we prioritize protein to stabilize satiety as well as lean muscle mass. The next piece does tend to surprise people, and it's our final macro, fat intake. Moral of the story is do not fear fat. For years, fat was vilified, especially in the context of metabolic health and weight balance. But in the context of insulin resistance, which we know drives many of our metabolic concerns today, the context is way more nuanced. Yes, a gram of fat has more calories than carbs or protein. When carbohydrates are controlled and protein intake is adequate, dietary fat can serve as a very stable energy source without adding to the glucose burden, but also being able to switch to fat sources or fat stores as a source of fuel is a mechanism that's underutilized in modern life as well. It used to be that the periods of feast or famine, as with our ancestors, allowed their bodies to more efficiently and regularly switch from burning carbs as fuel, which the body prefers, to fats as fuel. And so in this context, it's important to note too that just because fat is okay doesn't mean we're talking unlimited intake either. Clinically, when I see people still stuck after lowering their carbs or even eliminating them completely, it's often because they've replaced those carbs with regular grazing or inadequate protein or fat intake. So now that we've talked about each of the three macros and where they fit into the picture of insulin resistance, the next lever actually doesn't involve food at all. It involves what your tissues can actually do with that glucose to protect you. Muscle tissue is one of the primary sites where glucose is both stored and utilized. If your muscle mass is low or it's rarely challenged, the body simply has fewer places to move the glucose and fewer places to use it efficiently. And so the capacity side, or the drain, if you will, of the glucose that enters our body diminishes. Movement and resistance changes that. Lean muscle mass is a master regulator of blood sugar balance. And maybe you've seen pictures of the fitness bros saying they eat whatever they want and they still look the way that they do. But there's an element of truth in that, which is that muscle mass offers an important metabolic barrier. It may not be a green light to go ahead and eat whatever you want, whenever you want, but can become a powerful lever if you're trying to influence your blood glucose regulation in a big way. Over time, building and maintaining muscle mass increases your overall capacity for glucose. So instead of trying to constantly restrict yourself, shifting focus here in this area can really be a game changer. And reviews of the research consistently show that resistance training is associated with improvements in insulin resistance, even when weight loss is not the primary goal. So this is the strategic shift that helps some get out of that limiting mindset. And especially in our restrictive diet culture, it helps many people to turn the focus away from reducing and restriction and turning to a conversation and a focus on increased capacity. And in fact, and this one ignites some people, simply restricting calories via the calories in, calories out method can throw roadblocks in the chemistry in support of weight loss, fat burning, and satiety. Because fasting itself, or reducing calories, is a stressor that can tip the scales further on an already stressed out system. And this is why fasting is not often a place I start, except in particular circumstances. So when combating insulin resistance, you can boil it into two different areas. Nutrition supports the intake chemistry and signals. Lean muscle mass increases the drain and the capacity signals. When both sides are addressed, regulation becomes a lot more predictable. At its core, insulin resistance follows a predictable pattern. When fuel coming in constantly outpaces the body's ability to use it and processes it, the body's ability to use it, regulation and control start to shift. It's way less about willpower and more about how the system is balancing both input and capacity. When we start to think about it this way, another pattern becomes more and more clear. Fatigue and insulin resistance tend to show up together. If your energy has felt unstable alongside your glucose levels, check out this next video, which explores exactly that connection. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.